Hello, friends. Welcome to my Guardian Home Care YouTube channel with a new video about dealing with aggressive behavior due to dementia. Let's start the video. Dealing with aggressive behavior sometimes seems out of nowhere. Name-calling, hitting, shouting, or sudden anxiety. For caregivers, these aggressive behaviors in dementia can be heartbreaking and overwhelming. You may feel shocked, hurt, or even unsafe. But it's important to remember, this aggression is not the person's true character. It is a symptom of their illness, caused by brain changes they cannot control. The good news is, with understanding, patience, and the right strategies, caregivers can manage aggression in a way that keeps both you and your loved one safe while reducing stress. In this video, we'll explore why aggression happens, how to respond in the moment, prevention strategies, and when to seek extra help. Why aggression happens in dementia. Aggressive behavior doesn't happen randomly. It usually has a trigger. Dementia affects brain regions that control memory, emotions, and reasoning. This can lead to fear, frustration, or misunderstanding, which may come out as aggression. Pain, hunger, fatigue, or overstimulation can also spark angry outbursts. Sometimes aggression is their way of saying, "Something is wrong, but I can't explain it." By recognizing that aggression is often a symptom, not a personal attack, caregivers can respond with empathy instead of anger. Stay calm. First response in the moment. When aggression happens, your first step is to stay calm. Do not argue, shout, or try to restrain your loved one unless absolutely necessary for safety. Take a slow breath, keep your voice soft, and use reassuring words like, "You're safe, I'm here with you." Give them space if needed. Sometimes stepping back helps them calm down. Remember, if you react with anger, it can make the situation worse. By staying calm, you set the tone for de-escalation. One of the most effective tools is reassurance. Instead of correcting their reality, validate their feelings. For example, if your loved one is yelling because they believe someone stole their belongings, avoid saying, "That's not true." Instead, gently respond, "I understand you're upset. Let's look together and make sure everything is okay." This calms fear and anxiety, helping reduce aggression. Validation makes them feel heard and respected. When reassurance alone doesn't work, try redirection. Shift their attention to another activity, a favorite song, a snack, or a walk. For example, if they are pacing angrily, you might offer their favorite blanket or start a simple task together. Distraction can break the cycle of aggression and create a calmer environment. The goal is not to force compliance, but to reduce stress by gently guiding their focus elsewhere. Prevention is powerful. Keep track of what triggers aggression: loud noises, certain times of day, physical discomfort, or unfamiliar environments. A behavior log can help caregivers identify patterns. Once you know the triggers, you can adjust. For example, if evenings cause more aggression, create a soothing nighttime routine. If pain seems to be a factor, consult a doctor. Removing or reducing triggers prevents many aggressive episodes before they even begin. Aggression can sometimes become physical. In those moments, safety must come first. If your loved one is hitting, do not try to hold them down. Step back to a safe distance and remove dangerous objects from the area. If you ever feel at risk, call for help. Remember, you cannot provide care if you are injured. Protecting yourself also ensures you'll be able to continue caring for your loved one in the long run. Aggression is not something caregivers should handle alone. Talk to doctors about sudden changes in behavior. Sometimes aggression is linked to medical issues such as pain, infections, or side effects from medications. In some cases, doctors may prescribe treatments to help with agitation, but this should always be carefully monitored. Regular checkups and open communication with healthcare providers are essential to keeping your loved ones safe and comfortable. Caring for someone with dementia can be emotionally draining. Aggressive behavior can make caregivers feel guilty, frustrated, or exhausted. That's why self-care is not selfish. It's necessary. Take breaks, ask family for help, and connect with caregiver support groups. Learn relaxation techniques like deep breathing or short walks to reset your mind. A calm caregiver can respond more effectively in difficult moments. Dealing with aggression due to dementia is one of the toughest challenges in caregiving. But remember, you are not alone. Many caregivers face these moments, and with the right tools, they find ways to reduce stress and protect their loved ones. By staying calm, using reassurance, identifying triggers, and seeking professional help, you can make caregiving safer and more compassionate. Above all, remind yourself, your patience, kindness, and love are making a difference, even if it doesn't feel that way in the moment. Please subscribe our YouTube channel to get more videos regularly. See you soon with the next video. Bye!